Well, while Dr. Miron is getting all connected and sharing, getting his camera and everything on, welcome, Dr. Miron. I am going to share some housekeeping items for this evening. So first, I want to say welcome to everyone who's joining this evening. We're very excited about tonight's topic. I know we've got a lot of our Clarity members on and some Cares Aesthetic members on, and we also have a lot of guests joining us this evening. So I do want to review that it is a webinar style format, which means everyone will be muted and unseen unless you are a panelist, which you can see on your screen right now. We do have a chat feature, so you are welcome to open that chat window. I will be posting some information in there shortly after we start about how you can connect with our team if you have any questions about our platform or the things you're learning in the presentation this evening. You can use the Q&A feature also to post questions throughout the presentation because we will have a question and answer portion at the end of the presentation this evening. So if you are thinking of something along the way and you want to go ahead and post it in there, we will get to it when Dr. Miron has finished his presentation. So with those housekeeping things aside, we will actually get started with the evening. So again, welcome everybody to the Clarity After Hours community call. We have an amazing special guest with us this evening. I'm Lindsay Shaw, the VP of Practice Development at Clarity, and my co-host this evening is Senior Practice Consultant Robbie Grayson. Robbie is actually going to do our introduction of our speaker this evening. She knows him very well. So I'm very excited to turn this over to her and we'll get the evening going.
Thank you. Thank you so much. It's great to be here. And we're having just a touch of technical difficulty. Dr. Miron's having a challenge getting his video up. So can we just have one more minute? Because I don't want to
Absolutely. Absolutely.
give him the proper introduction because
Yeah.
I want to make sure we get this right. So
Absolutely. Dr. Miron, do you want to test your microphone as well and make sure we can hear you?
Yes, can you guys hear me?
yes.
Loud and clear. It's perfect.
Yeah.
Thank you.
I'm not too sure what's going on, but it just says unable to start video.
You know what? If you don't mind, we can go ahead and move forward. I would love for everyone to see your lovely face, but if we want to move ahead, that's up to you.
Sure, that's fine.
All right.
Oh,
Robbie, if you want to go ahead, I think, and I'll see on my side if I can, if there's anything blocking the camera on our
okay.
side.
Well, so I want to start first of all, just from a personal level. I met Dr. Miron, 3 years ago when I was his consultant when he developed his care aesthetics practice in Jupiter, Florida. And it was my first opportunity to work with a brilliant doctor, a scientist, a researcher. His credentials, I'll let him tell you a little bit more about his path. But it was a teaching practice too. So he teaches quite frequently all over the country. He's, I think, traveling tomorrow and on and on and on. But the thing that's very fascinating for me about him is that he is so ahead of the curve of what's happening in our industry. Right now, one of the top 3 trends that are growing in the non-surgical side of aesthetics is regenerative medicine, and that's Dr. Miron's his forte. I want to stop just a minute and try to let's get him on here because it's so important to me for you to see him. I'm sorry, guys. We know about technical difficulties. Dr. Miron, we're going to get this figured out. Hang on, because I want everybody to know you and see you. He is a big part of what we're doing here with the biofill. Lindsay, any luck?
I just tried again. It still says unable to start video. Can't share video, but if you guys can see my slides, I'm happy to present.
It wouldn't be something from
Dr. Miron, do you want to try again? I
Yep.
change one of the settings for you, but I'm not sure if
Ah,
it's.
there you go. I think it's going to work. There you go.
Hey, hey, oh, great.
Nice.
Look at, all right, there we go. Okay.
Sure he is. Yes, yes, yes. No, so as I was saying, I worked with Dr. Miron. We built a teaching practice. So he actually has an aesthetic practice in Jupiter, but it's also, the rooms are larger and he teaches all of the protocols. 2024 release, Dr. Miron, I don't know, you probably already know this, but the top 3 trends is regenerative medicine. And so all we're hearing now is PRF. We're seeing so many patients now that are preferring the natural biofields, exosomes and all. So I'm super excited. I'm not going to hold us up anymore because we're lagging a little, but Dr. Miron, so good to see you. Thank you so much.
Yeah, absolutely. Obviously happy to be here and always great to work with you, Robbie. Obviously, you made a big contribution to our practice in Jupiter. And, you know, I always say I was completely lost in this world of med spa world as a scientist, and you've made an enormous contribution to our practice. So thank you so much. A little background about myself. Obviously, I'm a researcher. I've done a lot of education, and for me personally, I grew up in Canada. I did dentistry. I also went to Switzerland and studied medicine and also pursued a PhD in molecular and cell biology. And the facial field was very exciting for me. And so I actually, after years of doing research in a research lab, I decided to pursue a master's in facial aesthetics because I thought that this all natural approach with using PRF, understanding lasers, and combination approaches would be one that would be very beneficial. I have written a lot of textbooks. A lot of the books that we've written are dedicated to platelet-rich fibrin, biomaterials. I think that in the PRF world, we've made pretty huge contributions, not just myself, but our entire team in Switzerland, so much so that the book companies asked us to write the very first textbooks on PRF and also the more advanced ones. The first textbook ever written on platelet concentrates in the field of facial aesthetics, our team wrote that. And then, of course, with our care aesthetics book, Understanding PRF for Patients, we wrote that small textbook to help patients understand what the differences between PRP and PRF are. As much as I love doing research, we realize that, you know, it's very important to have clinical practice. Today, we're very honored to say that our practice that we've established, and Robbie helped us tremendously with, you know, being a dentist, primarily on doing med spa type work. I've completely forgone doing dentistry. I focus exclusively as a dentist on facial aesthetics. I think dentists are very well qualified to do this because we understand facial anatomy extremely well. But also aesthetics are very important. I mean, when you look at somebody's face, they're not going to be quote unquote aesthetically pleasing unless they have great teeth. And the ability to combine those types of treatments with facial aesthetics is something that, you know, we kind of introduced to a lot of practices. I would say probably we're the fastest growing med spa in the whole world because in 3 years we opened up 224 centers, and you could imagine opening that many centers in such a short period of time has been a lot of work. But we do all the education for all these doctors. We teach them everything from PRF to lasers to Botox to fillers to PDO threads to how to inject lips. And we have a series of courses that we've offered over the years. Our most popular one today is teaching people how to use exosomes. And of course, my research lab is really focused on understanding platelet-rich fibrin, how to separate cells based on density, but also how to use growth factors, exosomes, and other things to even further improve, you know, the outcomes. The body is truly an amazing thing. So one of the things that we've done with this textbook, Understanding Platelet-Rich Fibrin, is really understand, you know, the body's intrinsic ability to heal itself, and then also to utilize this new technology to help patients heal. And this is most beneficial when we do aggressive lasering, for instance, and the patients have a downtime of 4 or 5 days, and we can cut this to 2 days or 3 days. You know, by using this technology, it's been extremely beneficial. This is not a facial aesthetic book. It's really a medical book. The first 10 chapters are really understanding the body. What is PRP? what is PRF, what are the protocols that we use. And then there's 6 chapters dedicated to how we use PRF in dentistry. And there's another 6 chapters on how we use PRF in medicine. And of course, in the medical applications, there's a facial aesthetics chapter. But in the whole world today, the university that I attended and spent many years at, University of Bern in Switzerland, we're ranked #1 in the world when it comes to citations per paper and really contributing to the field from a scientific point of view. Myself and many of my colleagues in Switzerland are ranked at the very top in terms of researchers that have contributed to this field. As a cell biologist, I have a PhD in molecular and cell biology. We understand where cells go, what they do. We understand red blood cells carry oxygen. We understand platelets help release growth factors, and that's the whole PRP world. White blood cells fight infection, and we can talk about how we can use these white blood cells to treat things like acne and other disorders related to infection. But as a whole, our research team was really focused on where cells go based on density. And so the reason why we're ranked, at the very top when it comes to this technology is we understand very well why PRP is an outdated technology. It's not something we use in the practice today. We figured out ways to remove anticoagulants and chemicals entirely, and we can make a new platelet concentrates that's all natural. There's no chemicals whatsoever. And it's cheaper than using PRP, but more importantly, every single scientific publication ever published comparing PRF to PRP shows that PRF is better. And the whole baseline behind what we're doing is we've essentially removed the anticoagulants from the tubes. We have a more natural way to harvest blood and spin them down in very similar ways. And when we reintroduce this into patients, they're actually going to clot, and clotting is the most important step for healing. And in the PRP world, for those that still use PRP, I always use the same examples, very simple ones. If you're in the kitchen and you're sitting there and you're cutting cucumbers, for instance, and accidentally you cut yourself, it's pretty amazing to think that your body's going to heal all by itself. But the very first step to healing is a clot needs to form. If a clot doesn't form, you're never going to heal. And so that ability to clot is extremely important for healing. And the problem with PRP is that when you introduce anti-clotting factors or anticoagulants into that formulation of PRP, when you take the PRP, it's got all the chemicals that prevent clotting. And when you put that back in a patient, they don't clot. And the most important step to healing is a clot needs to form. So that's, big differences there. And I would recommend people learn a little bit more about that. As a person practicing in the med spa world, it is a huge advantage to offer this technology, because if you really truly understand it and you explain it to patients, when the patients are like, oh, that makes total sense, I get it, you have a huge competitive advantage when it comes to promoting your practice versus others. And the ability to promote something that we love, lasers, of course, but using lasers, which are all natural, with a technology like PRF versus PRP, which is also all natural with no chemicals, the patients tend to like these technologies. So we've done a lot of research in the centrifugation world. We created the very first PRF system with horizontal centrifugation. And of course, this has been a lot of work over the years that we've done. It's been 20 years since we've done a lot of work in this field. I don't want to talk a lot about science because I think it's very technical, but for those that want to learn, you can go on the BioPRF website. We have more than 100 publications available for download for free, and you can learn a lot more about the technology. As a researcher working in university, this is a paper that's very, very well known in the entire PRP, PRF world. This is the most cited paper in the last 10 years, and our team wrote it. A novel method for evaluating and quantifying cell types in platelet-rich fibrin, and an introduction to horizontal centrifugation. In a nutshell, without going too scientific, we figured out what the problems were with main PRP, PRF centrifuges. A lot of them come in on a 45-degree angle. And the problem is when these spin very, very quickly, a lot of the cells go against the back walls of these tubes, And the gradient difference between the minimum G-force of the tube versus the maximum is very limited. When you put this tube horizontally, you can increase the difference. The G-force is much better applied, and the cells go to the proper layers more effectively. So I literally teach, whole day courses, and I spend 4 hours so that people can really understand what the differences are and the benefits, and really go through the science of where cells are going. Of course, I don't want to spend time on this tonight because we have an hour, and it's very, very scientific. Of course, I really want to talk about the applications that we use PRF in regenerative medicine, and also how we can use this in facial aesthetics. For those that have never seen a horizontal centrifuge, the tubes, they go in up and down. So you literally put the tubes in 90 degrees, so to speak. And when this starts spinning, it spins horizontally, and that allows the cells to go to the proper layers much more effectively. So again, scientifically, bigger difference between the RCF min versus max of the tubes. The cells, instead of bunching up at high G-force against the back walls, imagine when the centrifuge spins very quickly on a 45-degree angled centrifuge, all the cells accumulate on the back here. They can't separate it very effectively because they're all clustered back there, and they clump up and they can't go to the right layers. When you spin horizontally, the cells can go to the areas much more effectively. So that's a technology that we've really published a lot on. And of course, today, anybody, whether it be, the US Olympic orthopedic surgeons, high-end plastic surgeons, they all understand that A, we do platelet-rich fibrin, not PRP, and B, we spin horizontally, and we don't use fixed angle centrifuges anymore. I always like to, before we talk about use of PRF and facial aesthetic, talk about what we can do in medicine, because I think, of course, as doctors, we really want patients to heal as effectively as possible. This is a case right here that I treated personally, that the surgical dermatologist of this patient, who happened to be one of my good friend's wife, she developed a melanoma on her toe. And that's an aggressive cancer. And of course, you don't want that to spread to the rest of the body. And so in this case here, you're taught to remove the melanoma and then cover it with a skin graft. So Natalie is her name. The surgical dermatologist went to her arm and they did a skin graft. She still has a scar on her arm right here. They removed it, put it on her toe, and anywhere in the body, this would work 95% of the time. But the surgical dermatologist told her, this is on your baby toe on your right foot. And unfortunately, your heart is on the left side. This is your baby toe on the right side. This is literally the furthest place away from your heart. And while skin grafts typically take very easily, he had told her, I'm not sure the skin graft is going to take because it's literally the furthest place away from your heart. I'm not sure you're going to pump enough blood cells to that area to, incorporate that tissue. And so they did the skin graft. Unfortunately, it did not take. And my friend Natalie was left with this skin graft that did not take. And she was told then that she has to be scheduled for an amputation. And she was going to get her toe amputated. She lives in Florida with me. And she was quite disappointed about this. And she called me up with her husband, Scott, who's my good friend. And they said, listen, it's all related to blood flow. I know you do research in the blood flow world. Do you have a solution? And in that case there, we know that we can draw blood. We can super concentrate the growth factors in the cells. This right here is this is blood actually that's separated into different layers. So platelet-rich plasma or fibrin. The fibrin will make the clot. We took this, we made it with a super concentrate of these growth factors, applied it to the toe, and then we have to make sure that it's going to stay stable. So I was not too sure how I was going to do this, but I tried to tape up her toes and then around her foot and everything else. And I told Natalie, I said, we're going to put this on here. We're going to wait a week. We're going to remove it. And then we're going to do another, we call these biografts to make sure that they stay stable. And sure enough, this is after one treatment. She had already healed. And I did a second treatment, and that's her toe, which was scheduled for an amputation by a surgical dermatologist. And that's after this technology that cost only literally $2 to $3 for a couple tubes of blood, and we apply it to this area, and we're able to make, you know, significant regeneration to the point where she didn't need to be amputated. So we do a lot of this work. I collaborate a lot with surgical dermatologists today that treat much more complex disorders. You know, I like to show this, even if you work in facial aesthetics, you know, understand that the body has an amazing ability to heal itself. And if we can take blood and super concentrate it, what happens here in a diabetic patient like this one here? This right here is somebody's ankle, foot's in the front there, Achilles is located here. We're going to actually take blood, we're going to super concentrate the growth factors, and the surgical dermatologist here says, oh, you have diabetes. Diabetes is a blood flow related problem. You don't get blood flow to certain tissues. And most diabetics have problems in extremities, bottom of their feet. Why? Furthest place away from your heart. So this person, if this was you or I, we would probably heal perfectly fine. But this person without blood flow, their vessels start shrinking. And of course, a lot of them need amputations if you have a defect like this, because the big scare is if this gets infected and the infection spreads to the rest of the body, this person's going to has a chance of it being fatal actually from the infection. So what do we do in these cases here? We do the following. We draw their blood, we spin it down, and we super concentrate the cells that are responsible for healing. These are leukocytes, white blood cells that fight infection, and they're also platelets that are super concentrated roughly 10 times. This is not PRP, so it's not going to stay liquid. It's going to form a fibrin clot. And when we make this super clot, it has a lot more strength than a normal clot that would form. Just like my example of the cucumbers, when I cut myself, it makes a clot. This is a super clot because we have super concentrated the fibrinogen, thrombin, and the cells that are responsible for healing. We're going to take this, we call these biografts because they're biological grafts essentially. And we make this graft right here is made with 2 tubes for $2. And we're going to take this and we're literally going to bring it to the defect of our patient. So you see here healing that's going to occur. This person here was scheduled for an amputation. We fixed the problem, and this took 4 treatments. They cost $2 a treatment for the clinician. So it's really an amazing technology, and you can really help a lot of people by doing this. This is the doctor that initiated a lot of this work. His name is Dr. Castro Pinto. What you see here is blood that's separated. So of course we have the plasma layer and we have the red blood cell layer. He put it in the tray, he waits for it to clot. So just like when you cut yourself, your blood is liquid, but when it's exposed to air and oxygen, that's what induces the clotting. So we wait for that to clot. This is a diabetic patient. You can tell by his feet, he's very, very white. We're first going to inject the liquid PRF around the periphery of the graft, of the defect, sorry. We're going to take the biograft, we're going to place it to the area. We're going to apply it there. This is one treatment of a diabetic person that didn't heal in 6 months. With one treatment, they actually healed. And that's all related to your body's amazing ability to heal itself. So it's quite interesting. You know, this right here is a very close friend of mine. His name's Dr. Robert Talek. He's the U.S. Olympic orthopedic surgeon, and he teaches in all of our advanced PRF courses. As the U.S. Olympic surgeon, it's a very interesting story. He's obviously a medical doctor that graduated from Europe, redid his training here in the United States, so became a medical doctor, did a lot of research along the way, became an orthopedic surgeon at the top school in the world, which is a Cleveland Clinic, and then went to the Mayo Clinic and did further research. He's written many publications, 7 textbooks, and he's probably one of the most educated person that I've ever met in my life. And when you're not a plastic surgeon, an orthopedic surgeon at a very high level, you become a spine surgeon because spine is the most difficult thing to treat. And this right here is a spinal tear. These spinal tears are incredibly painful because there's fluid going in and out of your back. And when that hits those nerves, it's almost like you need a root canal in dentistry. You know, you think, oh, you got an opening in your tooth, you're in a lot of pain. Well, there's only one nerve in dentistry that runs to your brain. your spine, there are many more nerves, and these patients are in incredible amounts of pain. And this typically, when somebody has a tear like this that lasts 6 months or more, you do surgery, and it's a $120,000 procedure. You cut right down the middle of their spine, you open them up, you go find exactly where that tear is, and the orthopedic surgeon will put a piece of polymer, piece of plastic on the defect, put some screws in to keep it stable, suture them closed in many different layers. And if all goes well, the patient lays flat on a bed for about 6 months, can't do very much. You wait for healing to occur. And if all goes well, that defect will slowly close. And it's a $120,000 procedure. So this is the top of the orthopedic surgery field. If there's any complications related, a lot of times patients are in pain for a couple of years, and they actually refer to this as suicidal pain, because if you can't fix them, they actually commit suicide. And Dr. Talik in his courses really talks a lot about that. He started many years ago using PRP to heal these a little bit faster. And when PRF came about, of course, that was a better technology. So he started to use the PRF. And my research team, we developed what's called ALB-PRF, which is albumin gel and liquid PRF. But in a nutshell, it's a heated version of PRF. So we actually take blood, we separate the cells, we make a plasma layer. And that plasma layer, we actually take it to a little cooker. And when we cook the blood, the body takes 4 to 6 months to break it down. And if you work in dentistry like myself, we use this versus membrane replacements, collagen membranes. But in facial aesthetics, this has become a very hot topic. And I promise you, if you offer biofillers, we can make a replacement for Restylane or Juvederm. The biomaterial lasts 4 to 6 months, so it doesn't quite last as long, but it's 100% natural. It takes a clinician 10 minutes to make it. And the benefit is that it costs you about $2, $3 to make these. And I can promise you that patients that are over the age of 55, 60 would much prefer to have a biological filler injected into them versus a chemical filler. So we've done a lot of work in that space. It's been around for 5, 6 years. There's been other companies that have kind of replicated what we've done. Easy Gel, for instance, for those that have looked at what they've done, it's just a replica of what we've done exactly. And, my research team is the team that actually invented this whole technology. And so when Robert Talik read some of our papers, he said to himself, I would love to use that technology and repair these annulosus fibrosis tear using this novel ALB-PRF. So it's the albumin gel plus PRF, a novel autologous technique that may prevent patients more extensive invasive surgical procedures. So he'll actually inject, without doing surgery, that material in this area. And if it lasts 4 to 6 months and the body has an ability to heal itself, instead of having to do a $120,000 orthopedic procedure of your spine with a 6-month downtime, they do one simple injection, you wait 15 minutes for it to clot, and then you're able to walk right afterwards. And so it's really been a real breakthrough of science. This right here is the denatured albumin. So we take the plasma, we put it in this bioheat technology, it cooks the blood. Once it's cooked, it's hot. So of course you kill all the cells, so to speak, and the growth factors are gone. And what we do after the cooking process is that we're literally going to take the material and we're going to mix it with our standard PRP, PRF, in this case here, PRF, and reintroduce the growth factors into this biomaterial that will last half a year. This is exactly how we make biofillers. And so what you're going to see here is, and of course, our research team developed this whole technology. You're going to mix the albumin gel, which is going to last 4 to 6 months, and you're going to infuse it into the liquid PRF with all the cells and growth factors. So not only do you get a filler that will last 6 months, you also get all the growth factors that are going to help regenerate your tissues over years, over the coming years. So a lot of research has been done on this. Like I said, more and more companies are launching a similar technology. But again, this was something that our team developed in the year 2018, 2019. And it's been really cool to see people, even in orthopedic surgery, inject this into spines, knees, shoulders, etc. And the reason why I like to show this specifically is that you're going to see here that after this, it's being injected into knees, very commonly utilized. So this is just a little video of Dr. Talek here. This is the spine. So instead of doing a $120,000 procedure where they have to cut the patient open, put 300 sutures into them, he's going to literally, and what he's doing right now is he's saying X-ray, X-ray. This is a C-arm scanner here. So he's making sure he's in the right direction. He's looked at an MRI, so he knows exactly where to go in. And following this, you're going to see he's got the needle in the right area. And now he's going to inject the ALB PRF. So that's the mixture that he just created. That will be injected, okay? And once that's injected, imagine you get a little Band-Aid instead of doing a huge surgery. So that's not so bad. And this is literally 15 minutes later.
Straighten your knee. No pain. No. Okay, the other leg. Perfect.
So if you hit it the right area
come
and
back
it
to
covers
me.
the hole, the patient's able to walk again. And really amazing to see the work that he's done in that space over the years. Now, this is actually a really interesting photo because this is Dr. Talek here with the Korda sisters. For those that don't know, the Korda sisters, these are professional golfers. In fact, Nelly is the #1 golfer in the world. And before the Olympics, Nelly had a spinal tear and she was told that she had to do surgery. And golf is a really bad sport for people's spines because they're always whipping around golfing. So it's really bad for your spine. And in her case, as the #1 golfer in the world, who's won a lot of majors, she was in her mid-20s and she had to do surgery. And she consulted with a lot of other golfers that have done surgery. And the most famous golfer in the world, in my opinion, that has done many back surgeries is Tiger Woods. And they both live in Florida. And Tiger Woods had an amazing career. But what derailed Tiger Woods from his huge success is spinal surgery. In his late 20s, Tiger Woods had a back problem, spinal tear. At the time, 20 years ago, he was taught, you got to go to your orthopedic surgeon, you got to do surgery. He said, okay, I want to keep winning all these majors. He does the surgery. He never heals correctly. He may win 1 or 2 more majors, still has back problems, does another surgery and another surgery and another surgery. And to this day, Tiger Woods, when he consults with these young athletes that have the same problem in golfing, he says, if I can go back in time, I would not do the surgery. I would either try and heal myself on my own, and I'd rather take 1 or 2 years off from golfing completely to heal on my own, or I'd rather just forego my entire career because I've had so many problems. So he tells this to these young athletes. Nelly Korda, she says, I don't want to do surgery. I'm going to heal on my own. 1 or 2 years, I'd rather heal on my own. The Olympics are about to take place a couple of months ago. This is in January. Nelly Korda consults with the U.S. Olympic orthopedic surgeon, Dr. Talek, who's been using our technology for 5 years. Dr. Talek says, you don't need to do surgery. Don't worry. We're going to draw your blood. We're going to make a biomaterial by cooking it, and we're going to inject it into your spine. And since he's the U.S. Olympic orthopedic surgeon and has been for a number of years, he says, don't worry, don't be scared. I'll put you in contact with many professional athletes that have done the exact same thing to repair their spines, knees, etc. She calls some of them up. She says, you know what? No surgery. I'm happy with doing the injections. He does the injection in January. By mid-February, she's healed. She starts training again. And now she goes to the Olympics. She competes in the Olympics. She ends up winning a gold medal in the Olympics. And once she won gold medal in the Olympics, Dr. Talek got this photo because right after the Olympics, she was on the cover of Golf Digest. And not many females make it to the cover of the most important golf magazine in the world. And they signed it for her. They put it in a frame. They sent it to her. And I remember Dr. Talek took this photo immediately, sent it to me. He's like, Rick, without the technology that you developed, this young professional athlete may have her career may have been over. And I just injected her and everything healed. And you'll note here, she wrote a little note, dear Talek family, because his wife works with him, you are the PRF that holds us together. Okay, and this would never be possible with PRP, ever, no chance. And so there's been a big evolution in the space. Dr. Talek and I have actually, last year, we trained every single orthopedic surgeon that's part of the NFL to learn how to use PRF instead of PRP. So when I see these clinics that are still using PRP and don't understand the technology differences, et cetera, it's really a pity, because you can make this much cheaper for yourself, but more importantly, you can actually heal your patients and your pro athletes and your facial aesthetic patients, et cetera, much more effectively by understanding the technology. So that's something that we really try and improve patient care for our patients. Next up, we have a little video here. I like it a lot. I like the video a lot because it's another Olympic athlete. This one here is a cheerleader, and he happens to have millions of followers with his wife on social media, talking about what he does. He trains all these young females, young males to do cheerleading, be excited about it. But he had a shoulder injury and a labrum tear that derailed his career. Of course, he had to do surgery, and talks about, you know, when he got PRF instead of it. And the one reason why I like to show the video is when Dr. Talek explains the benefits of PRF versus PRP, and understanding that the body has this amazing intrinsic ability to heal itself, and how the body creates almost this perfect microenvironment for healing naturally. We all have an ability to heal ourselves. So if we can take that, super concentrate it, and use it to further help our patients heal, we're providing a very great service for our patients. So I'm going to go ahead and play the video here, so that you guys can watch it. I think it's a real exciting video.
Well, I am a competitive cheerleader. I also teach as well, teach children all over the nation. So we do clinics and stuff like that, teaching the sport. And I specifically, in the sport of cheerleading, am known as a base or a stunner, and I co-ed stunt. So everything I do is throwing of flyers into the air, and a lot of that brings a lot of impact on our shoulders. So that impact has what brought me in here today, because I've due to the sport, I've been living with an injury for about 4 years. So my body's a little fired up at the moment, and I'm just trying to find a way to get back to being normal and get back to my old self and get my strength to where it was, so I can get back in the game.
So I finished my medical studies in 1992. So I've been in medicine little over 3 decades. Regenerative medicine is a subspecialty of medicine that we are trying to harness innate healing potential of the body to heal diseased or injured tissues. It's compared to traditional treatment. It is mostly focused on restoration of structure and function and returning patient to normal life.
Cheerleading has become my life, the sport, and me having this injury, it takes a lot from me, because I'm on more of the physical end of getting these girls in the air and teaching them and being able to show them instead of just talking to them, and letting them actually physically feel what they need to do and teach them as well. So me being injured takes away from that ability to give them that knowledge and give them that extra step and one-on-one lessons and learning when it comes to teaching cheerleading.
PRF, or it's an acronym for Platelet-Rich Fibrin. It's a blood-derived biological material. It is 100% derived from patient blood. It's a concentrate of human platelets. It is considered second generation biological or platelet concentrate that overcomes most limitation of its predecessors, such as platelet-rich plasma, or known as a PRP or PRFM. It is, compared to other predecessors, PRF is completely natural. It's 100% free of any chemicals or any additives. It's completely from the patient blood. So it eliminates issues like allergic reaction, immune system rejections, or any other problems with the predecessors?
So before I got into cheerleading, I was a football player and I actually had a labrum repair on my shoulder. So I've been through surgery. I know what surgery feels like and the extensiveness of it and the length it takes to recover from surgery. And anything but surgery is the best option. I've tried cortisones, I've tried all these steroids and stuff like that, and nothing seemed to help. It was more of like a Band-Aid, and I want a permanent solution. And I've done a lot of research and gained a lot of information on this PRF injection. So I'm very excited about it, and I just want to get back to my old self, and I believe Dr. Tyler can get me there.
PRF right now is close to ideal biologic material because it almost exactly mimics a microenvironment of injured tissue. So when we use it, PRF allow us to stimulate innate healing potential, and also it contain almost exact proportion of cells, growth factors, and other materials as natural body. So this is very important for incorporation of this biomaterial and promoting healing.
So the procedure went smoother than I actually anticipated. Dr. Talib was very informative with how things were going to go. And then through the process, it was easy. I didn't feel no pain. It was just a quick drawing of blood and spin it and re-inject it. And it was simple as that. It took no less than not even 2 minutes to do between both injection and drawing of the blood. So it was really, really quick. I think what comes next after the initial process is what matters most, and that's the recovery, and that's the putting time into rebuilding and restructuring and getting healthy and doing what needs to do to take this all the way.
I believe that once you come to our clinic, you will never look at patient care same, because we have really spent a lot of time and effort to make this care and our experience for our patient really personal. We really focus on entire patient because we need to team up with the other patient to engage in regeneration and recovery. So I would be happy to help any patient they feel they would like to see different alternative to traditional treatment.
All right, so in my opinion, a really great video, really explaining from one of the top doctors I've ever met in my life. You know, we're talking about somebody that's very well educated, 7 textbooks, 22 years of university around the world, and treats many pro athletes today. And he teaches some of the best courses on use of platelet concentrates in orthopedic surgery. I promise you that these guys have many years ago let go of PRP and have further improved patient care. In fact, when we talk to him, he says 1 PRF injection is probably equal to 3 to 5 PRP injections. And so when I try and inject somebody's knee, I can do 1 PRF injections or I can do 5 PRP, and I still feel the benefit is better with 1 PRF injection. So, you know, that's kind of exciting to see that. I don't do any joint injections, of course. That's not my field of expertise whatsoever. But when I see somebody like that using the technology in such a space, and I say, hey, why can I not use the technology? Am I really scared to inject this in somebody's face when the orthopedic surgeon since 2018-19 has been injecting into their spine? And when you think of the biological component, it's entirely natural. There's not a single chemical in there. So like you said, you can't be allergic to your own blood. You can't cause a foreign body reaction. You can't cause a vascular occlusion, and you can only help regenerate your patients. So I honestly feel to this day that fillers, which were great, and of course, as a master's in facial aesthetics, in non-invasive, minimally invasive facial aesthetic procedures, I've injected a lot of fillers, a lot of Botox in my life. I still love Botox and Daxxify. I think it's great, and we can paralyze muscles. But when I have the option of either placing a chemical synthetic filler into somebody or giving them a more natural filler, I always like to take the more natural approach. A lot of times, and by a lot, I mean 80% of the time, I can achieve the desired outcomes that I want in a more natural way. And if I can't get there, then you know what? Then I'll pull out my Juvederm and Restylane and use it sparingly, but at least now I have to use a lot less of it, and I'm not putting as many chemicals into somebody's face. And I still feel to this day. You know, I live in Florida, very close to Boca Raton, where, you know, they call these people with Boca lips and this and that 10, 15 years ago, this was really cool to look unnatural and have too much filler. And today, this is kind of reversed what we actually want. We want patients to look as natural as possible, but just look like themselves 10, 15 years ago. And that is achieved with, in my opinion, two technologies, platelet concentrates and lasers. And I can't talk enough, not just lasers, but energy-based devices. You know, that whole space and the technology is improving so fast that what you can do with a laser today versus what you could do 20 years ago is dramatically improved. And the reality is look at Botox. Botox, what you did 20 years ago is primarily the same today. You know, the technology is not really improved. In fact, the formulation of Botox is identical over the last 20 years. And we have Daxify now that, yes, lasts a little bit longer, but for those that have done enough of these cases, you realize that it doesn't really last that much longer, and it's very similar technology. Lasers have improved so much over the last little while that now it's really a game changer, I would say, in the aesthetic space. I mean, I don't know how med spas exist without energy-based devices, because we have a lot of them in my office. I mean, Robbie has coached me on getting some of the better ones, of course, that I've potentially never even heard about. And we use them every day in the office. And it's been really, really great to use the technologies and the amount of improvements in the laser world. The same thing is true for the platelet concentrate world. So a lot more people know about lasers. And I believe that today, the reason why is because these are $100,000, $200,000, $300,000 devices. So these companies put so much money into advertising these and trying to get you to buy these. And here we are in the platelet concentrate world where we're selling these devices, centrifuges that are $2,000. And when you buy the tubes, they're literally $1 each. So it's not like it's expensive, but at the same time, these companies that produce this equipment, they don't have these thousands and millions of dollars to go out and advertise like crazy, because there's just not the same type of margins on this. So this patient here, I've treated this patient with one of my good buddies, Scott Delbacho, 2 treatments, lasers and PRF. You can tell that her skin's been resurfaced. She looks much better. She's got volume loss in her cheeks, nasolabial folds, marionette lines, chin area. You can see just from the orange peel look, etc. This patient has 0 chemicals inside of her. There's no Botox, there's no fillers. We did this all naturally with platelet concentrates and lasers. And, you know, we can still charge a decent amount of money. You know, we charged her $1,400 times 2 to do 2 treatments. Some people would say you probably could have charged a lot more, but it costs us literally, when we have the equipment and it's paid for, these treatments cost us no more than $100, $200 to do. And they're very high profit margin procedures. But more importantly, I feel good about doing these treatments because I've made this person look a lot better, but I haven't put any chemical in her body. And so I've done, you know, a job that I consider as a doctor. I've done her a big service. Not only does she look a lot better, but I didn't have to use all this Botox and fillers in her case. And so that's what we want to try and promote and talk about. Everybody here knows microneedling with platelet concentrates. I mean, this is not something that I need to share with this group because you guys are all very well educated, very well popularized by, you know, the Kim Kardashians and those types of the world. We like to use the technology. I don't do very much microneedling with PRF or lasers alone. Quite honestly, I like to use a lot of things in combination approaches, because in Florida, what I found is that I live in a very, very highly instant gratification world. People can come to me or come to people that work in my clinic and they want Botox and fillers and they can look amazing a week later. And so how am I going to compete with that kind of competition when I'm just doing microneedling with PRF? You know, yes, it's a great treatment. It's very good for them. But the reality is I may not be able to compete with Botox and fillers in that case. And I still believe that even if I did what I consider to be one of the best laser treatments in the world, a halo treatment, the reality is I'm still not competing to the same level of some of these people in the Botox and filler worlds. A lot of people like doing combo approaches. So if I can do a halo, but I can use platelet concentrates And let's say I do a halo, I can't fill volume. So yes, I can tighten tissues, I can get rid of pigmentation, but if this person is missing volume in their cheekbones, what am I going to do with a Cyton halo device to reinstitute that lost volume? I can't do anything. But if I can simply just inject biofillers in that patient and do the halo, that person is going to come back to my office a week later and be like, hey, I love my results, right? If I just did halo, yes, they still love it and they still say great things about it. But if I start stacking these treatments together and they're all natural and I'm not putting a single chemical inside them, and it doesn't cost me a lot, it costs me almost no extra money, that person's going to be very, very satisfied client. And if I can do that repeatedly and spread that around my city in Jupiter, Florida, which I think is a very competitive area for facial aesthetics, of course, very, very wealthy area. But of course, we have a med spa every, mile. There's a med spa somewhere. You got to have some tools in your toolbox that can really distinguish you differently than the other person that's just doing Botox fillers and maybe some lasering, but not as advanced as we are. So, we do a lot in this space. I like this technology too. These are pictures from our textbook. This is just microneedling with PRF. So everybody knows that you can use this technology, diminish fine lines and wrinkles and scarring. Nothing new here. We use it to treat acne. A lot of people ask me all the time, how do I treat acne? And the reality is that what we found, and we've done a lot of studies and research on this, is that there's no single treatment that will work for everybody. And there's a lot of variability in the population. And so when we have these acne type cases, you know what I do? I pull out my technology and I say, okay, well, let's figure out what's going to work best and then we'll treat the rest of the face. So up here in this quarter, I might do microneedling with PRF. And here I might do a BBL. And here I might do an acne treatment with Fotona and PRF. And here I might do BBL with PRF. And here I might do, Fotona plus PRF plus the BBL. And I just do some spot treatments everywhere. And the more technology I have, the better the chance that I can find the exact protocol that works best for that patient, because there's no one solution that's going to treat acne in 100% of the cases. And if they say, oh, I happen to like the BBL plus PRF in that case there, that worked the best for that patient in this little quadrant here, we'll treat the entire face with that technology. Another patient may not react so well with that. They may like the ND egg with Fotona and we'll use that technology on them. So, I always believe that the more technology that you have in your practice, the better you can do for patients. And at the end of the day, your reputation is worth $1 million times 10. So, we do what we feel is always best for the patient. This is 2 treatments using lasers and PRF, microneedling. And, we do this frequently in the office, and then what worked for him might not work for the other person. And this is just another example. This patient here, was treated with just microneedling and PRF. They did not react so well with the laser. It actually made things a little bit worse, but we did some test spots. And then for these young people, instead of putting on Accutane, we can do a lot of good. A lot of work was done with lasering, obviously, intraoral lasering, etc. So these are just different protocols that we use. But we really realized many years ago that the ability to make no chemicals, no fillers, all natural regenerative sciences, it's something that we promote a lot. In my office, we do a lot of Botox. We do a lot of not just Botox, Dysport, Daxxify. We're running studies actually with the companies right now. We do a lot of Botox. I would say it's 30% of our practice. We bring in a lot of patients that want to do these treatments, of course. I don't like to promote them that much because I've realized that, you're going to spend $5 a unit for Botox, you're going to charge 10, 12, whatever. Well, even if you charge 14, it's almost, if it feels like half the money is going to Allergan. And over time, even though this is an easy procedure and it takes you 10 minutes maximum, and it's offered, well, how much better is my Botox than the nurse practitioner down the street, or the PA down the street, or the plastic surgeon over there, or this or that? You're not going to have a huge competitive advantage. But if you happen to invest in very good technologies and you have experience with those technologies, of course, because understanding how to use, you know, a photonal laser versus RF microneedling versus, you know, Cyton Halo versus BBL versus IPL, and understanding the nuances of each one of them will really set you apart from other people. And so we really said, you know, our practice at the homepage, we wanted to really focus on no chemicals, no filler, all natural science, regenerative science. And I think patients tend to like that. You know, the trends 10, 15 years ago was, I want to be different. I want my lips bigger. I want to stand out. I want people to know that I've got fillers and this and that, just like I've got a big diamond ring and an expensive watch on me, right? And today the trends are not that way whatsoever. The trends are actually, people want to look younger, but they actually don't want people to know that they've had anything done. And so by using natural approaches, you know, you really have a huge advantage, because you're never going to give somebody a filler, you know, overfilled face with fillers. You know, you can't do that with lasers, and you can't do that with PRF. So we focus a lot on that. I think we've created a nice niche for our community. You know, we've grown very, very fast in the med spa world and franchised out 220 clinics, where a lot of other doctors just follow very similar approaches. And we actually ran our very first care aesthetic symposium, and it was out of the blue. We literally started promoting it 60 days ago, and we brought in about 120 of our clinics to just attend and just listen to, you know, what we felt would be great to have other people there. I know Robbie was there and gave one of the better presentations of the group, but you know, we had a lot of exciting stuff that was there, and nice hands-on at the final day with new technologies and everything else related to that. So it was a lot of fun to be part of that. But we have a lot of care aesthetic clinics. These are all natural procedures, and it's not that we don't do, you know, chemicals and PDO threads and Botox. I mean, I actually think that in my office, Dr. Cornell, who teaches Botox and fillers and has for years, is one of the best filler injectors probably in the whole country, in my opinion. But the reality is that if we really want to market ourselves differently than other people, and we really want to develop protocols that have very high profit margins, we want to put even those patients that have done Botox and fillers their whole lives, we would like to consult with them and talk to them about the advantage of doing regenerative therapies and do things that are maybe good for your skin, and be able to, you know, do procedures that we feel are great for the patient, you know, their health, their skin, etc. And at the same time are very high profit margins. But even if everything was the exact same dollar amount, if I can do, you know, 3 biological fillers and 1 filler versus 4 chemical fillers, even if everything was the same cost and the same profit margins, I would personally feel a lot better, because if that was my mom and I could use 1/4 fillers and 3/4 biological stuff and get the same outcomes, of course, I'd feel real happy about that. And that's how I treat all my patients. So that's just a little note on that. You know, these are cases here with using lasers and PRF and combo approaches. So this is a male patient, we can do stuff. These are other cases with lasering and just before and afters on both sides. So, you know, you can really do a lot of amazing things. It's one of the reasons why I say, you know, Botox has not improved in the last 20 years, but could you have done this with a laser 20 years ago? No. You know, quite frankly, the technology just wasn't there. So we have a lot of, you know, cool things that we can do for our patients. You know, this is another video that I'm going to play right now. Somebody that I treated, a 72-year-old lady, Nancy, doing all natural regeneration with lasers and PRF. I always tell colleagues that, you know, do some, they come to our lectures, I say, watch this lady and watch what she talks about, and ask yourself, do you have such patients in your practice? Because she's 72 years old. She never really thought that much about doing facial aesthetics, but, you know, maybe throughout her life in the last 10, 15 years, she wanted to look younger. She was kind of against doing Botox and fillers, even though I told her, hey, Botox will make you look better, certainly, but she was against it. And so we did what we call a biocare procedure, where we did lasering intraorally and extraorally and did some microneedling with PRF, etc. $1,400 treatment that cost us less than $150. So it's 90% profit. And I do that treatment on her now every 6 months. So every 6 months, I'm making $1,400 times 2, that's $2,800. So almost $3,000. And if I can find 300 of such Nancy's in my office, that's $900,000. I almost make an extra $1 million, which are all profit, with just 300 patients. And it's the same 300 patients that I'm going to see year after year, building this $1 million of recurring revenue, which is all profit, which I can do in Botox world, but it's not all profit like it is in here. And there's a growing need for and demand for patients that, you know, want these types of services here. So I'm going to play this video of Nancy here. And I don't want you to look at the before and afters, because yeah, she looks better, and we've done lasering and we've done, you know, PRF, but more importantly, look at her after one treatment and ask yourself, do you have such patients in your office today?
Hi, I'm Nancy, and I have had my 3 protocol series. I felt like my forehead was in good shape, but things were beginning to sag, and it was time to do something, and I did not want to go under the knife, that's for sure. So this is a nice, easy way to accomplish what I think is going to happen. All of those issues that I was concerned with when I came in here, I'm very satisfied and very happy with the end results. It was an interesting experience. I didn't know what to expect, to be honest with you. I knew it was going to be laser. I did not know we were going to go inside the mouth. I knew we were going to do some needling. I've just been really happy with the process from day one. When it first happened, it was like, you don't know what's going to go on, but when you get through that first treatment, you kind of get an idea of what's happening. I will have to say the procedure was certainly tolerable. I didn't experience any particular, if you call it discomfort or pain, if you will. And I'm sure there's different tolerations of pain, but you're doing it for beauty, you're doing it for an end result. So bottom line, it's all worth it. And it's not very long. So if you experience some discomfort, then you can get through it because it doesn't last very long. Your advertisement, first of all, caught my eye. And when I read more about it, it even got more interesting, particularly because it was a natural way to get younger looking skin, hopefully. I'm 72 years old. And I didn't want to look like a 30-year-old. I just want to look like a better version of myself. And that's what I've found, a better version of myself.
So of course you can see that she looks much better, glowy skin, lasering. Anybody that does lasering, etc., knows the benefits, etc. So and by adding the growth factors, they typically heal a lot faster. You know, I absolutely love treating scars. It's probably my most favorite things to do. And this is a person that had 2 cancers on her nose. She came in consulting in my practice, and she literally walked in with her face, like her arm or her hand over her scar. And I would tell her, like, you need to show me your nose so I know if I can treat it or not. But could I treat this 2 times in a row? She came in for consults and she said, my plastic surgeon cannot treat this. Why can you? And I told her, they may not have the laser technology that we have, and they may not do in the PRF. And if we combine both those together in the same treatment, you know, we can do a lot of good for you. And this is after 2 treatments of treating her. And she was so happy, you could hardly tell her scar at all anymore. And these are my favorite treatments to do by far, because we've treated a lot of these patients. You know, this is somebody else, car accident. Plastic surgeon said, tried to reproximate the tissues. That was the best he could do. And that plastic surgeon in my area did not use lasers and did not use PRF. And, you know, this is after 2 treatments, and we've helped her tremendously. But quite honestly, I was disappointed with the results because I wasn't able to remove this, and I could still see the glare there. And I said, we need to do a 3rd treatment, and it's going to get rid of it entirely. And she was so happy that she didn't want to do the 3rd treatment. So, you know, these are technology can really take you a long way. And I truly believe this, that whatever I'm saying today is not going to be the same thing in 10 or 15 years from now, because, you know, there'll be other scientists that are going to come in and make PRF much better than I ever made it. And there are people that are using laser that are going to make it much better than the lasers I use currently. And that's a great field to be involved in. How much better is Botox going to get in the next 15 years? Probably not a whole lot, maybe exactly the same. But if you work in this world of lasers and PRF, you know, and exosomes and all these other things, you know, it's a really exciting time to be involved in a lot of this type of research. And that's where, like I said, with the biofiller and the ability to inject this blood that's been, you know, heated in that last 6 months, you know, you can really do a lot of good. And that's how we get to these results. So it's really a combination of lasers and a combination of PRF that allows us to do such treatments. And, you know, if you're involved in some of this technology, there's really a lot more that's going to be done in the coming years. So I really wanted to explain a lot about PRF because, you know, I could spend literally, we teach courses that are 24 hours on what is PRF and how we use it in facial aesthetics. And of course, if anybody has questions related to this, you can email me here at rick@themironlab.com. I really wanted to tap into a little bit on exosomes as well tonight, but I just realized that, you know, the amount of data that we have on exosomes and the 5,000 papers that are published, it's just too much. I mean, it's just a whole other field, and it requires at least another hour or two of education. So, you know, maybe at some point in the future, we'll do another webinar on exosomes in the coming months. But in any event, if people have questions, like I said, this is my email, and you can go to our website and download a lot of our papers. And there's a lot of good exosome related papers too that we've published recently. So
Yeah, Rick, that invitation is open. Let's plan an exosome.
Absolutely.
Yes, yes, yes. Yeah, no, clearly, with our new startup people, we recommend you. It's like I said, the the top 3 trends right now, regenerative medicine. I know you've been doing it for a long time. You're so ahead of the curve, but it's so, I mean, this is fascinating. Thank you so much.
absolutely.
Dr. Miron, we do have a question. It came up. We actually have Asia is asking the question, could you just give a brief explanation of the order or the protocol that you like to use for your laser and the PRF combo? They have the erbium laser, which is similar to the halo, and she's curious kind of what that treatment order or protocol looks like for you.
Yeah. First and foremost, you know, the erbium is a great laser. It's definitely very, very safe. I would say that any erbium, like I have a photona, it's different than the halo, definitely, because it's firing 2 wavelengths, and the halo will be deeper penetrating as well, and tighten the tissues a little bit better. But generally speaking, we always tend to do lasers first, followed by PRF. And it's very logical. Think of it this way here. If I did, let's say, microneedling with PRF, right? I apply microneedling, I put PRF in the skin, that's a great outcome. And I decided to now do lasering over top of that. Well, what is the laser attracted to? What is erbium specifically attracted to? Water, which is in every cell. So all of the cells that I would apply, I would be literally burning and vaporizing all of my platelet concentrates that are super concentrated. Bad news. If I do it the opposite way, and I vaporize the skin, I create, you know, a fractionated erbium peel or whatever laser you have exactly. I created damage now. And after the damage, if I put the cells that are going to regenerate the tissues, that's a much better approach. So we've actually done a study comparing both in different orders. And when we do the PRF after the laser, it's 8 times more effective than the reverse order. So we always do it that way there. Lasers first, PRF afterwards.
And on again with that kind of thinking about the protocol, if you are going to do multiple treatments, Dr. Miron, how often do you space those out? Is it just your typical laser protocol, or is there something different when you're using the PRF as well?
It really depends on the lasers, definitely, because so many lasers are so different. For instance, like if you're going to do a full-blown CO2 full peel, You only want to do that once every 10 years or so, right? And if you use PRF, of course, you heal a little bit faster, but that will not be similar to the BioCare treatment like I showed with Nancy, which is an erbium peel only with PRF, which I can do one treatment every month for 3 treatments. So it's very, very different. And it really depends on the lasers, how aggressive you are. And I'm sure, Robbie, this as well as anybody. The downtime for a lot of these treatments is very different. I don't like doing a halo more than twice per year, honestly, because if you're aggressive enough with it, I'm either doing it once per year during the winter months from November to March is what I tell my patients, or if they're, really need some benefit from it and they haven't done a lot of treatments, I'll do it twice per year every 6 months or so, but that's the protocol that we use for there. If it's Fatona, it's a little bit lighter. I can do 3 treatments 1 month apart. There's no issue with that because it's less aggressive. And it really depends on the treatments, the protocols. There's a real big science behind it. It was funny. I was speaking to somebody in my office. Literally, we did a course this Monday, Tuesday, and they said, "How long is it going to take me to learn how to use lasers, Dr. Miron? Like, can I learn this in 3 weekends and 3-day courses?" And I was sitting there with probably 2 or 3 other doctors that have been using lasers for a number of years. And I looked over at the other gentleman and I was like, "What do you think?" And he literally said, "It's going to take you years, right? It's going to take you years. You can start using it after a couple of weekend courses, etc. But you're going to be really good at what you're doing. It's going to probably take you a couple of years to be like adept to the point where you can really modify protocols and really understand interactions on skin and healing and on and on and on." So I like the idea of starting with, I like erbium lasers personally because they're not that aggressive and you can really do a lot of good for patients. I think Cyton has really created something that's really beneficial in terms that they fire the other wavelength that's going to tighten tissues at the same time in a very safe way. Like, it's very hard to do damage, like actually like hurt somebody, so to speak, or have a negative outcome with the new technologies. And then as you get better, can you do a full ablative CO2 and etc.? Yeah, when you know what you're doing, absolutely. And that's kind of, it's a loaded question to answer because I hate the doctors that try and teach lasers and they're just like, "Oh yeah, watch me do it and I'm going to do a full ablative peel and everything's great and we're using CO2," and you're just looking at this like a beginner probably should not be doing this, right? So but it's like anything else with fillers too. I mean, you start with safe injections and as you get more and more comfortable, you're going to broaden your scope and do more in that space. So which
Thank
makes
you.
it exciting.
She said she is new to lasers, so thank you for
Yeah.
sharing and giving your explanation.
Yeah, I think it's an exciting field. I tell all of our doctors that take our courses, this is really the future of aesthetic medicine. I don't know how you're going to own a med spa in 10 years and be competitive versus people that have lasers and have been using them for 10, 12, 15, 20 years. You're just not going to be competitive doing Botox and fillers only. So the faster you get on that bandwagon and that bus and you drive that bus forward, I believe the more successful you're going to be. And I think a lot of people that are in the med spa world, we're not like, I wouldn't consider myself like a basic person. I mean, we have 200 med spas around the country and we're coaching them on how to do things more effectively. We want to be driving the bus forward. We want to be ahead of the curve always. And so this is very important. Yeah, you may be new to lasers today, but guess what? Maybe 15-20% of med spas currently use lasers. So, yeah, you can still be ahead of the curve if you just get on that bandwagon, now, and you start to, perfect your skills. And in 5 years or 10 years, you're going to be much ahead of the curve and have probably a very profitable practice. So.
Yeah, one of the things that I really enjoyed when I worked with you, Dr. Miron, when we were doing the launch and working with your team, and I'm going to make a point here is to be able to communicate that to your team, which you did so beautifully. You taught me things about, like why I'm fair and just how to talk to the patient, how to educate the patient. The patients are becoming a lot more savvy. and want this information. So, you know, educating your team too is so important. And we had a great 2 days of doing that with your group so that they can then translate that information prior to a consultation to get the patient in the door.
Yeah, I mean, when we look at different fields of medicine, we oftentimes charge patients for consults. You know, and I know different people have different opinions on this because I'm sure you even have a different opinion. But I always viewed it as like when I was used to doing dentistry, for instance, I was used to just a patient coming in for a $3,000 implant and then they were gone. And so we would charge them because I didn't want to waste my time with a patient that was just trying to get info from like somebody like myself who's, you know, done a lot of work in that space. In the facial aesthetic field, I really view it as a way that if I can really educate the patient and make them understand why they should use PRF instead of PRP and why they should focus on energy-based devices and understand all these things properly, I'm happy to give my free time to do it because my hope is that, you know, they can understand what I'm trying to translate to them and be like, you know what, this person has spent a lot of effort to learn all these things, to buy the right technology, to offer what he feels is the best services. And they're going to sign up for these $1,400 procedures every 6 months, twice per year. And that patient is going to be a $3,000 per year patient or more. And over the next 10 years, that person is going to be worth $30,000 to $50,000 for a practice in high profitability procedures, right? So I spend a lot of time trying to educate patients as best I can. So, you know, I think it's very valuable.
And it's important if you're just starting out with lasers that you're able to do that, I think. And that's really was the point I was making is that, I mean, I'm a laser junkie. All of you who know me well know that there's nothing I love better than all my laser procedures. But, you know, I say use all the tools in the toolbox, and the energy devices are definitely that. So, yeah.
Mm-hmm. Yeah. Yeah. I think, you know, it's amazing that in this space here in aesthetic medicine, you get asked a lot of questions by patients that really drive your education forward. And what I mean by that is even when I first started in it many years ago, if I got asked like, oh, we're doing this laser and I never heard of that laser, just naturally being a provider that wants to learn more about it, and especially, of course, a lot of the staff in our practice are, I don't want to say mainly female, but they're really mainly female. They want to look better too, the females. So it seemed like everybody in the practice was really wanting to learn more about that technology. Even we don't have it, we don't offer it, but they want to learn about it. Whereas I can't think of another field of medicine where somebody comes in and says, oh, I really want, you know, this dental implant, or I really want this hip implant or shoulder implant. Like nobody's going to come in and the doctor says, I need a shoulder replacement. I recommend this shoulder replacement for you. No patient's going to be like, oh no, I don't want that one. I want this one. But in aesthetics, they actually do that,
Oh, I know.
right? And so it's pretty amazing. And it actually forces you to learn a lot more if you're excited about the field, because you're going to learn all these extra things, which I think is it's really exciting times. And when the more you have been asked that question, the more you learn, the better you can address their questions. So, yeah, you know, one pet peeve that I have actually in the field is these educators that, and it can be in any discipline, and I never wanted to be this person, but the person that is just like the hardcore Photona user or the hardcore Cyton user or the hardcore this user or whatever it may be. When those people, you go to their offices and you try to learn from them, when they've only ever used that one device and they're like the key opinion leaders for those companies, they just are so blinded to all the other possibilities that exist with other technologies. And so, you know, we've always tried to, you know, learn as much as we could. I've taken many courses, and I continue to take courses all the time, because even though people say, oh yes, you know a lot about lasers and PRF, the reality is there's still an endless amount of things for me to learn.
Yeah.
And the more I know, obviously, the better I can help my patients out. And I find it very exciting. I mean, I find it super exciting, and I never want to be in a place where technology is not moving forward very quickly. So it's super exciting and keeps me motivated to keep learning. So
No, I'm with you. I absolutely love the field we're in. I'm always learning the regenerative, the peptides, all the things, exosomes. That's why we've got to have you back and talk about exosomes.
Sure, I'd love to. Absolutely.
So
Absolutely. Well, thank you, Dr. Miron, for joining us this evening. And the presentation was amazing. We're already getting feedback about the great stories you shared and the amazing photos, and just what a wonderful presentation. And we definitely want to have you back. So we will get with you, Robbie and I will get with you, and we'll start making a plan for what that looks like so we can share out with everybody. I'm sure it will be highly attended as well. So again, thank you everybody for attending this evening. If you do have any questions, of course, Dr. Miron's information is on the screen, and we put our information in the chat if you'd like to reach out to us about the presentation this evening or any additional questions you have. So thank you all and have a wonderful evening.
I have a question real quick
Oh,
before
yeah.
Lindsay. Will this be recorded for our community?
It is. So if you are a Clarity member, it is recorded and it will be available in our community module under the recorded calls. So as always, it takes our team a couple of days. We make sure that we, cut off a little bit of the wait in the beginning and some here at the end probably, and we get it trimmed up and ready for you, and it will be up in a few days.
Perfect. Thank you. Thank you so
Yep,
much.
absolutely. All right, everyone. Have a great night.
Have a great evening. Thank you so much. Good to
Thank
see
you,
you.
everybody. Yeah, absolutely. Thank you, Robbie.